Good morning, Den family. Good afternoon or good evening, wherever you are in the world. Gonna go through some crap that's happening in real life to the transgender people who are medically transitioning and have gender dysphoria in the transsexual community that has gender dysphoria and what's happening to their medical benefits because of the brain rot rectal tards who are saying, quote unquote, we're allies, but you don't need, and the trans population who are also saying, oh, you don't need gender dysphoria to medically transition. First off, you're liars. So if you don't have gender dysphoria, you're not trans. Period. End of story. You're a bunch of freaking liars. What else it's doing is it's causing medical benefits to be denied paying for to help people or to medically transition who need it. I've been struggling with my insurance company for 2 months to pay for facial feminization surgery, which had been previously fought for and approved, paid for by insurance companies. Now the rectal tard retards who are saying you don't need gender dysphoria are starting to ruin it for adult transgender, transsexual people who need this insurance to help pay for their medical coverage. Until I don't want to see people commit suicide. But you assholes and bitches and cocksuck faces who are doing this shit to where insurance companies are denying the coverage are putting the transsexual population and transgender people who are medically transitioning with gender dysphoria and have insurance that would have paid for it. It's becoming a catalyst, going to start becoming a catalyst for trans people to commit suicide because they have no other way to afford it and they can't live like they are. I'm not going to commit suicide. At least I hope not. I'm going to tell you what, there's people who will. And it's because of you, assholes. They're lying about not having gender dysphoria, needing gender dysphoria to transition, medically transition. If this starts to happen, their blood is on your hands as a catalyst. And you should be held responsible for perpetuating their freaking suffering and suicide. You should be held legally responsible, up and to include jail time. People have fought too long and too hard and suffered too much and too long to get the medical benefits that we have. For you assholes and brain rot tards to try to destroy it. For lying. Willfully and intentionally, and you know you're doing it. It needs to stop. You need to stop the harm. Your fault for people losing medical benefits or getting denied medical benefits that are needed for adult trans patients. Am I angry? You're damn right I'm angry. Foresight was 2020 on this. I guess hindsight's 2022. Or hindsight is 2020 also. Because it's happening. It's happening in real life. And it's your fault. The people's fault who are saying you don't need gender dysphoria to medically transition. Well, good. If that's what you think, shut up. Because people who have it, who need these medical benefits, are suffering because of your lies. If you want to believe you don't need it, then that's fine. Believe it. But I'll tell you what, it's affecting insurance payments. And that's wrong, and you know it's wrong. I don't wish any harm on any of you, but when you die, you will rot in hell. You burn in a lake of fire. The reason for people losing legitimate people of gender dysphoria is that who have serious and chronic depression. I got depression over it. Because of it, yes. I'm trying to keep these insurance companies to where they have some care and compassion to pay for this stuff. For us people who have gender dysphoria and suffer from it. To pay for these things that help alleviate gender dysphoria and depression and anxiety. But you assholes who are saying you don't need gender dysphoria or depression or anxiety to get medical benefit, to be transgender and medically transition, you're killing other people. Because insurance companies are denying services. Say I'm struggling with my insurance on appeals. And I don't know if it's going to do any good or not. So far, it hasn't. It's been 2 to 3 months. If it's happening to me, I'm not the only one who gets a guarantee. I'm not the only one. I actually care about people. I actually care about these brain rot rectal tards you're talking about that not needing gender dysphoria to medically transition. I want you to have a decent life too. But you need to stop harming us who have gender dysphoria, depression, and anxiety because of it. It's ruining the chances of those who need the insurance to pay for these benefits, medical surgeries, and other medical procedures to medically transition. A lot of us don't have the money for it. Or it takes so long to save up the money, it's almost not worth it. But it is worth it. Just think of it, if you or somebody you actually loved had cancer and they were denied medical treatment that would save their lives. But the way you're going on a trans people who need medical coverage, guess you don't care. Because if you did, you'd shut your damn mouth about it. Because you know it's going to affect insurance. And it's starting. And I know I've talked about medically transitioning children and getting them the proper medical care, which is psychological therapy. And whatever else they need for prescriptions to help their depression and anxiety so they can have a decent life, go through puberty like they should, and really find out if they are trans, because that's exactly how they're going to find out whether they're trans or not, is to go through puberty. And have that persistent, consistent, agonizing pain with going through puberty to find out if they really are or not. That's the only way it's going to be real, is for children to grow as healthy as they can without medical, prescribed, or surgical interventions. 80% of those who do not go through medications with medications as a child, it works out and they are not trans. 80 to 90% are not trans if allowed to go through puberty. I'll tell you something. But I guess you don't give a damn about facts. You just want money. People want money. Pharmaceutical companies, doctors who perform the surgeries. Not all of them are like that, but they're about money. I'll tell you what, pharmaceuticals are about money. Because as soon as somebody starts long-term prescriptions for puberty blockers and cross-sex hormones, man, they're going to need medication, whether they continue to be trans or not, or they detransition. They're going to need prescription medications for the rest of their lives because of it. That's causing harm. 80 to 90% of the child population, you're destroying their lives because of your bullshit. If you say you're trans, and here's your prescription. And from female to male, here's your double mastectomy as young as age 13. Chloe Cole, 13 when she had a double mastectomy. She's a detransitioner. You retards think you know everything. You think you're God. You'll burn in a lake of fire in hell. And I hope it's painful and agonizing and torturous. Especially if you continue to do it till you die and don't change. I would like to see you change. Save your own soul. And show some compassion for us who need the insurance. And have the medical reasoning to do it behind us to be able to do it. Stop the harm so it can be reversible before it's irreversible. Just stop. Period. Because you say you care, but apparently, well, we'll see. I doubt it, but we'll see. Anyway, for now, that's enough. And I will be back again for another stream at another time. Have a wonderful and great day. And if nobody told you they love you today, I love you. Thanks for tuning in.